PBMs were behind it. PBMs are the pharmacy benefit managers, or the middlemen, and they play a role in these higher drug prices. PBMs were created to facilitate the claims process, but they've grown in good faith to manage and lower prices as a third-party administrator. However, as we've seen throughout the country, when you leave a middleman to themselves without little oversight and a temptation to high profits, this drives the wrong incentives. This result has artificially inflated the cost of prescription drugs to all of us. The three largest pharmacy benefit managers control over 75% of the market, causing harm to our patients and our independent pharmacies that are the backbone of our neighborhoods and the patients they serve. One example that we have found was on the everyday drug for ADHD medicine. The cost of the drug was almost $20, yet the PBM charged the plan insurance $120, profiting $100. This is price gouging, and just one example of how PBMs profit off the backs of patients, pharmacies, and taxpayers, and this practice needs to stop. This practice does not discriminate. It affects all of us. It could be your children's inhaler. It could be insulin for your grandmother's diabetes. It could be a drug for Crohn's disease or high blood pressure. I've received calls from so many constituents complaining about the high cost of drugs, and that they cannot take their drugs and end up going to the hospital instead, which ends up increasing the cost of healthcare. In many instances, patients with high deductible plans end up paying their co-pays and co-insurance based on this inflated price, and not even the PBM negotiated price. This savings should be passed down to the patient, and this is a gross abuse of a free market that we're elected to protect, and this is wrong. This is why today, with the support of fellow legislators across both aisles, I have filed the Prescription Drug Reduction Act, House Bill 961. This comprehensive piece of legislation will create transparency from prescription drug pricing and positively affect patients' wallets at the pharmacy. Specifically, this bill will prohibit the practice of steering, which requires patients to go to the PBM to own pharmacies. This is self-dealing, and we will not allow for that. It will prohibit spread pricing, which is charging a health plan one fee and paying the pharmacy a much lower fee. PBMs should be passing those savings down to the patient. This will also create a layer of transparency. PBMs will report to the state on a quarterly basis, disclose any conflicts of interest, and health insurers shall have access to the use and PBM services. And lastly, this PBM will require the bill will require that the PBMs act as fiduciary duty to the insured, which means they will act in the best interest of the patient and not their own pockets. I look forward to working with our legislators on both chambers, our Attorney General, our Commissioner of Insurance Commissioner, and our CFO to come up with a solution that will reduce the harm that is caused by increased drug prices. And now I'd like to ask Senator Rodriguez to come and speak and offer some of his comments.
Thank you. I'm State Senator Jose Javier Rodriguez. Afterwards, Senador Español para los medios en español si quieren. State Senator Jose Javier Rodriguez, I'm here proudly in support of PBM reform, along with colleagues from the House, especially Reps Toledo, Fine, and Brown, as they work on this very important legislation. This is not just a pocketbook issue. This is a life and death issue for many of our constituents here in Florida. Dealing with the cost and the management of and availability of prescription medications is really, really important to us. And if we're going to do anything about it here in Florida, we need to tackle the reform on PBMs. PBMs started out as a means to reduce costs. They were supposed to reduce costs by negotiating prices down. And they have ended up making the problem worse. They do not manufacture medication. They do not provide health care. One of the things that we we've seen is vertical integration. They are muscling out the little guy. We've also seen them exert control over the formulary, right? A lot more control over what is prescribed and to whom. Again, often pushing more expensive drugs to pad their pockets. Keeping information from consumers, limiting their choices. Increasing rebates that they get from the manufacturers instead of reducing the costs. They get passed on to those who need the medication. And the last thing that I'll mention in terms of what has been happening and what the PBMs have been doing is that much of the profits that they've made are from government contracts. So we're also talking about taxpayers and not simply about those who need the medications the most. I'm here again in support of Reps Toledo and Fine. There are 7 senators, myself included, that are in conversations about bills that we will be filing in the Senate. Senator Harrell will be filing a companion bill, but as I said, there are many more of us. Senator Wright, myself, Senators Berman, Mayfield, Reuters, Perry, are all in support of many of these reforms, and we've been in discussions with each other about the components of this reform. We're all in agreement. Transparency is the baseline. We need transparency as to what's happening. Tackling spread pricing, as the representatives do in their bill. Leveling the playing field. Making sure that we can deal with steering, which is an anti-competitiveness issue, as well as other policies that we're thinking about, like getting rid of a gag clause, right? Similar to what has been done at the federal level, but making sure that pharmacists can do their job and that consumers have access to accurate information. Thank you. And I'd like to introduce Rep. Fine.
Thank you, Senator, and thank you, Representative Toledo, for allowing me to be the prime co-sponsor on this important piece of legislation. A long time ago, I taught economics, and I'm a firm believer in the power of free markets when government doesn't get in the way and mess them up. And unfortunately, that is what has happened here. In a world in which you create a marketplace in which the middleman, the person who sits in the middle, is also allowed to be a retailer, where the distributor can also be a retailer, you create structural incentives that subvert the system. Because no longer is the person in the middle trying to maximize retail scope, retail breadth, and lower prices. Now you've created an incentive where the person sitting in the middle attempts to self-deal and help themselves. And that is the problem that we have found today. The problem is created even worse by the fact that we have an oligopolistic situation, as Representative Toledo talked about, when a very small number of companies can control a very large part of the market. The government has a role to step in these kinds of situations to make sure markets can operate in free and fair ways. And there's one other reason why it's important that we are here today. Because the drug prices that the consumer pays are not transparent. While not necessarily the focus of the bill today, the consumer doesn't pay what the drug actually costs, even to the PBM or the pharmacy, as they go and they redeem their prescriptions and they use their insurance. They pay something that is pre-negotiated. So for all of these reasons, markets are not allowed to work freely and fairly in a way that will lower the prices for everyone. It is in that way that even Adam Smith himself said that government had a role to get involved to make sure that markets function in a smooth and seemingly appropriate way. So that's why I am proud to work with Representative Toledo, Senator Rodriguez, Representative Beltran, Representative Brown, and all of the other folks out there who are committed to make sure that our constituents pay the lowest possible amount for what is a commodity. Because when you go and you get your prescription, it doesn't matter where you buy it, it's still the same drug. The drug itself may not be a commodity, but the retail of it is. And so that service should be able to be offered at the lowest possible price, whether it is our consumers and our constituents that is paying for it, or frankly, whether it is the taxpayer that is paying for it through a Medicaid or a Medicare or any one of a number of government programs that exist. So in the defense of free markets, I'm proud to be working with my colleagues on this bill. With that, I would like to introduce Amanda, who is the owner of this pharmacy and can talk about her experience and how this bill might help her.
Good afternoon. I'm Amanda Reese, and my brother Kevin Worcester and I own Westshore Pharmacy. My dad started this pharmacy over 20 years ago, and we took over back in 2008. We are very excited to be hosting this press conference for Representative Toledo to outline her House bill, Bill number 961, which will ensure that patients have access to pharmacies like ours, help provide transparency to payers, and eliminate predatory business practices. Independent pharmacy in its current form is an unsustainable business model when a market that's dominated by 3 players can pay you an amount that's less than what we paid for the drugs just for us to be ordered to serve our patients. We make a copy of each claim that we bill where we are paid below the cost of the drug, and as you can see here, this is from 2019, and this is not even all of them. This is just the ones that were actually printed out. So there are a lot of prescriptions where we are not being paid for the cost. It happens to us every day. It happens to us all day long, and it's just the beginning of the unfair business practices that this industry has been able to get away with and has yet to be fully addressed here in Florida. This bill addresses the practices that are forcing pharmacies to close at a rapid rate here in Florida and brings back competition and consumer choice. We appreciate Representative Toledo taking on this issue, as it's not a simple one, and some would say that it's designed to be this way. We ask that our other elected officials and the governor give representatives full support of this bill that will ultimately help all Floridians and stem the tide of rising drug costs.
Good afternoon. Thank you, Amanda, for hosting us here today. And thank you to Representative Toledo for this wonderful bill. This bill will benefit patients, providers, payers, and taxpayers, and provide much needed reform to the PBM system in Florida that will lower the cost of drugs and allow access to pharmacies and allow patients to have true choice in their choice of pharmacy and provide much needed transparency in pricing for payers and end consumers. I'm an independent pharmacy owner, and we are under assault in Florida by an industry whose function started out as a simple claims processor, a transmission interchange, and has become something much bigger than that. The supply chain now allows them to extract rebates, to play on each other, to own their own pharmacies, and to otherwise extract a huge amount of profit from the system, a profit that exceeds the true value of the service that they provide. As pharmacists, we are on the front lines of healthcare. Patients turn to us for everything. Advice that may keep them from an unnecessary doctor visit or emergency department visit. Maybe advice on living situations, hospice situations, things of that nature. Patients love us and they want to be a part of our pharmacy system. Increasingly, though, they're being steered away from us, from the pharmacy of their choice and to a corporate pharmacy as greed overtakes and inserts itself into the practice of pharmacy in this state. This type of self-dealing is illegal in most other industries, and this needs to cease. Every day I hear horror stories of patients that don't receive their medication on time, frustrations from mail order prescriptions being delivered hot or not at all, and annoyed with the level of service that distills their interaction with our segment of healthcare to an 800 number or a drone.
bad and unfair practices of PBMs put independent pharmacies at a disadvantage. Our competition is the one that sets the rules of the game, and if the rules become favorable to us or unfavorable to them, they simply change them. Pharmacies have to pay fees on transactions that we make. We pay fees in audits, clawbacks after the point of sale, things that are just nonsensical in the practice of our healthcare. PBMs are creating a barrier to enter the market in this state, where a new pharmacist must wait a year or 2 years or 3 years in order to receive a contract, in order to accept insurance, sometimes taxpayer-funded insurance. Pharmacies in Florida are closing at an alarming rate, and it's escalating. We need PBM reform. We need it now. If you want to see lower drug prices, you want to see enhanced competition, you want patients to be able to choose the pharmacy that they use, then these practices have to stop. And we appreciate Representative Toledo for taking on this enormous issue. And it's going to take an enormous effort on all of us in order to return the practice of pharmacy healthcare to the pharmacists. Thank you.
At this time,
Hi, my name is Dr. Brandon Conkle with Florida Cancer Specialist Center, oncologist. As you can imagine, receiving a cancer diagnosis is a life-altering event. We've come far with drugs to treat and manage cancer, but actually getting patients access to those drugs remains a real challenge. And PBMs add an additional layer of complexity in this already difficult situation. PBMs aren't doctors, but they're making healthcare decisions for our patients. In our practice, we have the whole patient to treat, and patients don't just fit into nice, neat categories. If someone has other conditions, renal failure, liver failure, frail, sometimes drug A, the preferred formulary choice of the PBM, isn't at all the right choice for them. And we waste precious time having to go back and forth with appeals to try to get them the drug that they actually need. We often operate in a narrow window of time in which a drug can actually help the patient, and so delays can seriously impact quality and quantity of life. If you're running late for a critical meeting, the last thing you need if you have to stop for gas is to go back and forth with the gas station attendant proving that you actually don't take things in your car. When we do have an agreed upon plan for the patient as far as medication, PBMs will often limit patient choices in pharmacies by steering these expensive medications to their own pharmacies. This is not a cost saver, as plans hardly ever know what they're paying for, and when asked for that information, they're told that it's proprietary. The black box of pharmacy pricing is just that. There is no transparency. Additional issues, particularly long delays, arise when PBMs mandate that patients receive their important medications from mail-order pharmacies. Urgently needed medications should rightly be dispensed face-to-face by a pharmacist who is actually accountable to the patient, and not be contingent on the proper functioning of mail sorting machines in Oklahoma City, or the good graces of the package thieves in your neighborhood trying to steal your Amazon order. All of this is adding to the high cost of drugs, introducing unnecessary delays, and lining the pockets of powerful corporations whose interests run counter to those of our patients. PBM reform has been a long time coming in Florida, and we're excited that Representative Toledo has introduced House Bill 961. We look forward to supporting these efforts that will ultimately provide better access for patients, drive down the cost of medications, and provide patients with better care. And isn't that the goal?
next we will have the director.
My name is Loretta Bosie. I am the founder of United for Safe Medications, and also the director of transplant survivor, and his life relies on medications every 12 hours. I'm also here today to represent 100 starting the petition, I quickly gained support and learned over 100 other risks with mail-order pharmacy other than temperatures. Most of the patients that shared, and they continue to share their stories, were forced against their will to mail-order pharmacy as the only option of coverage for the life-saving medications. The stories that I hear daily are absolutely appalling. A faulty value-based system enables PBMs to reward their own pharmacies more for meeting certain standards. Yet the PBMs, mail-order pharmacies, that many are being forced to across our nation, if you look on the Better Business Bureau, they either have an F rating or a 1 star. I don't know any other business that can continue to see record-breaking stock values with such poor quality ratings. Again, this is an obvious sign that mail-order pharmacy is not about patients, it's not about us, it's about their profits. Thousands of lives are risked for the abuses of PBMs solely for nothing more than profits. Their greed has no limits. There's unnecessary delays and interruptions of treatments and medications that at one time we could have in our hands in 15 minutes. The same medications are now taking 5 to 7 days. There have been MS patients that have lost their ability to walk. Adults and children with cancer are experiencing unnecessary interruptions in their chemotherapy treatments that could hinder patient outcomes or prevent them from beating cancer. Pregnant women with diabetes are unable to eat because medications don't arrive on time. For other patients, their insulin up north arrives frozen and ineffective. And sadly, one of the hardest things for me to see is transplant patients like my son, whose life depends on medications every 12 hours. Their medications don't arrive on time. Patients have been injured, they've died due to medication administration errors that could have been prevented with a crucial face-to-face relationship with a trusted pharmacist. Sadly, it's only after the mail-order pharmacy risks our lives that they'll sometimes approve a one-time override for patients to the level of pharmacy. No one is planning ahead. Where will these patients go for emergency refills when our pharmacies close? What did we do as patients to deserve to be forced to use a 1-star or F-rated pharmacy? What did we do to be forced to risk our lives and the lives of our children and to have the critical relationship with our trusted pharmacy removed? What did entire communities do to have the only pharmacist in their area removed from their coverage or they're forced to close due to the greed of the PBM's unethical practice? The steering away from our trusted pharmacists and the low reimbursements don't just put patients' lives at risk, but the lives of entire communities and our nation. Our nation's health is also at risk. Patients' lives depend on choice of pharmacy and safe access. PBMs don't prescribe drugs, they don't manufacture drugs, they don't dispense drugs, but somehow they've figured out a way to make billions of dollars off of the drug marketplace at the expense of patients. As patients and caregivers, I think it's about time we start getting the benefits that we're entitled to without having to navigate the complex hurdles that PBMs require everyone to go through.
Thank you, Loretta. Now we'll hear from another patient and advocate, Mike Snyder.
It's quite different standing up in front of the cameras instead of sitting comfortably on my couch. But as much as this is shocking, it's not nearly as shocking as your doctor telling you that you have cancer. So this is a really serious matter. I want to express my gratitude for the legions of dedicated doctors, nurses, healthcare professionals that have all contributed to keeping me alive today, and other patients like yourself. My life changed in July of 2013. I was hospitalized for renal failure. I think everything is going to be the same from day to day, then one day in the hospital, cancer, 3 weeks. I got a new lease on life. I look at life much differently than I did before. They discovered I had a form of cancer called multiple myeloma. There's no cure for multiple myeloma. chemo drug that I was on for 4 years stopped working. And my doctors, because of my kidney condition, put me on, they recommended me go on another chemotype of drug. The PBM made a decision not to put me on that drug, but to change the prescription of my doctors. The PBM does not have access to my medical records. They had no idea that by taking the drug that they prescribed, it was going to further damage my kidneys, and then I might not be here today. My oncologist, Dr. Marte, and I have a specialist over at Moffitt, Dr. Boz. I refer to him as the Wizard of Boz. He's one of the best in the country, maybe in the world. And they fought. These two talented doctors fought for months, writing rebuttals and getting denied and then resubmitting claims until they were able to get me on my current medication. But this was months, and I was able to get through, but other people in my condition did not have the luxury of time. So this 2-month period of unlicensed professionals making medical decisions on my behalf who did not have access to my records is insane. So it's ludicrous that insurance companies are able to dictate to doctors how to best treat their patients. In what kind of a world, in what world could an unlicensed individual without the ability to access my medical records make medical decisions? You must put a stop to somebody having the ability to override my doctor's decisions. I would like to correct the term PBM, pharmacy benefits manager, to PBM patients benefits manager, because it's really about the patient's care that we're here today. Thank you for your time.
Next we have Carl Schuessler, an employee benefits advisor this morning.
Thank you, Representative Toledo, for powerful legislation. Thank you, Amanda, for allowing us to be here. I want you to pay close attention to Amanda because she's a dying breed. We work with community pharmacies all over the country. We represent employers, we represent the payers. We work with employers and their employees building their benefit plans. And I can tell you from our standpoint of advising companies, it's extremely difficult to read a contract you can never see. So Michael said, but I call them program built in millions, is what they stand for. But you can't see, you can't manage that which you can't measure. And so when you work with employers, they're signing away their lives without even knowing what they're signing. They can't see any of the details, nor could they understand them if they could see them. So what we've been able to do is we have been able to eliminate the middleman in some cases. And we've worked with employers, 157 employee company that worked with one of the big threes that was spending their $500,000. They were able to cut their costs in half. So what you can do with that is you can help these employees take care of themselves, because right now we have a functionally uninsured America. Deductibles have been raised, out-of-pockets have been raised, because the employers couldn't afford the insurance anymore. They shifted all the costs to the employees. Now the employees can't take the medicine because they can't afford it. So now we have diabetics that aren't complying and checking their A1Cs and doing their diabetic test strips, and therefore they end up in the hospital in the ER and become an inpatient admit. So we've done the exact opposite of as a country. So we need to turn it around and change it. Healthcare isn't broken, it was made this way, as we like to say. So I think that's really important. And I think also what Amanda and her family's done here, healthcare is local, it's not regional, it's not national, it's here. These pharmacists help take care of people, and we need to let them take care of them. The PBMs make it very difficult to take care of them. We need to relocalize care and bring it back home so that everyone can take care of each other. Neighbors take care of neighbors.
As as you can see, we have so many people that are here to talk and share their stories because we are at a crisis mode right now. And we as legislators need to act so we can protect people like Loretta's son and Mike, and make sure that this doesn't happen anymore, and we need to stop this behavior from happening with the PBMs. At this point, I'd like to take some questions if you guys have any for me or for the pharmacist or anybody in the room. Any questions?
The average consumer may not know what a PBM is, but they see their drug costs go up and up more every day. What can you tell us what your bill would do to reduce those drug costs?
Well, it would provide some transparency, so the PBMs would have to disclose how they are making their money. And it would prohibit the practice of spread pricing, which is charging someone more than what the drug actually costs, or reimbursing the pharmacist less than what the drug costs, because that's what they are doing right now. And also, it bans the practice of steering. So instead of you coming to their own, the PBM-owned pharmacy, you have a choice, which you should have a choice in which pharmacies you can go to, and we should all be reimbursed at the same rate.
Have you had any pushback on your bill?
I expect some pushback, yes. Anytime you go after $1 trillion industry, you're probably going to get some pushback.
How would you deal with the forcing us to go on the mail order subscription? For example, we've been pushed into the mail order. We do have the choice of filling the scripts locally for 3 times the cost, or go to the mail service.
So I have heard from several people that have been forced to go through mail order pharmacies, and they're paying even higher costs than what they would pay, have to pay at a local pharmacy or at a retail pharmacy. So it really depends on the drugs, but forcing someone to go to a specific place is not the answer. It's not a free market. It's anti-competitive.
Well, in the spirit of patient care and patient safety, are you hoping to also looking into the metrics and push on pharmacists to make unethical decisions, or just any decisions to meet their goals, just because they have to, otherwise they would get fired, or are you only just looking into the pharmacy benefits manager?
This bill deals directly with pharmacy benefit managers, but I'm always open to addressing any issues